Good afternoon, dear friends, or good morning, depending where you're watching this from. I welcome you to the third EMSI Video Podcast Series on COVID-19 implications and the Eastern Mediterranean. And today we focus on migration in the Eastern Mediterranean and COVID-19. And we have with us the pleasure of two distinguished guests, Mrs. Katja Saha, who's the representative of the UNHCR in Cyprus, now with a lot of experience, 16 years of experience with UNHCR in plenty of places, Africa, Latin America, Middle East, Europe. And my understanding is that the experience extends both at the country level operations and as well as at the headquarters. And also Mrs. Natasa Xenophontos Koudouna, the head of the Office of the UN Migration Agency, the International Organization for Migration, IOM, in Cyprus. Mrs. Koudouna also worked at the European Commission in Brussels from 2002 to 2007 at the cabinet of Greek Commissioner Anna Diamandopoulos. So thank you both for accepting our invitation. It is a real pleasure to have you with us. And I'm sure we will have a very interesting and what is a very timely conversation, I believe, given the situations. So before we start with the questions, I think it's worth noting that before COVID-19 found us, immigration and the refugee crisis was easily one of the hottest topics, especially in Europe, in political terms and societal terms, and it was an issue that influenced politics, it influenced societies, it changed governments, it led to populism and so many other things. But since COVID-19, it seems that the focus has taken a back seat, basically the focus on immigration. But that said, it's just the focus and attention that changed, not the essence of the situation. So there's still refugees, there's still immigrants, and if anything, probably, and this is something we can discuss, COVID-19 made things even more complex. Whether they're worse or better, something you can tell us, but it certainly made it more complex. So I think we should keep this in mind during our discussion to try to figure out how COVID-19 created this complexity on the issue. But before we start, I would like to kindly ask you to kind of make this distinction of refugees and immigrants, because these are two terms that are frequently conflated. And I was reading a study that came out, I believe it was a year ago, that actually, in Cyprus at least, indicated very clearly that people are quite confused. So if any one of you or both would like to make this distinction for us so that we can kick off the conversation.
Thank you, Constantinos. Thank you for the invitation, first of all, and the opportunity to discuss the issue that's very close to our hearts at UNHCR. So our mandate covers asylum seekers, refugees, internally displaced persons, and also stateless persons. So there are many categories that we are concerned about, but first, starting with asylum seekers. Asylum seeker is a person who has fled his or her country of origin due to certain protection reasons that are outlined in the Refugee Convention. So the reason that was not a voluntary departure from the country, the person was obliged to leave because there was a risk for the person's physical well-being, or there would have been a significant, what we would consider persecution that the person would have faced and maybe already faced. A refugee is a person who has been formally recognized to have this kind of a fear of persecution. So asylum seeker status is not a formal status. It has not been confirmed by any government or UNHCR. Any person who flees is considered an asylum seeker. Asylum seeker then either is confirmed to have that fear of persecution and a valid reason that's outlined in the 1951 Refugee Convention, and that is confirmed either by UNHCR or or a government, depending whether it is the government or UNHCR that is in charge of the status determination in that given country.
Thank you. Would you like to add something? Yeah, on
yes,
this?
Thank you, Dr. Adamides, first of all, for inviting the International Organization for Migration to this podcast, and in particular to bring out, first of all, that COVID challenges all humans everywhere, and also bring to the fore that migration and migrants should also be part of the mitigation measures to let's say, mitigate the impact of that illness. So as regards your question, and thank you for your question, migrants and our mandate is anyone who has changed their habitual place of residence, either by crossing an international border or within their own country, for any reason, and any type of status. So that includes, for example, international students and migrant workers.
Thank you. What do we observe the most in the Eastern Mediterranean? What is it? Immigrants? Is it asylum seekers? Is it refugees? In terms of numbers, if you know.
Maybe I can contribute to that by saying, first of all, that in the Eastern Mediterranean in April 2020, we have seen for the first time a 6% registrations vis-a-vis to 50% in the western route and 44% in the central route. It was for the first time that we had seen the western and central routes overtaking the eastern route in the registration of irregular arrivals. Let me just start by that. Overall, up until the mid-June this year, a total of 7,700 arrivals by sea were recorded in the Eastern Med, which was a sharp decrease again on the 40% vis-a-vis same period last year. In Cyprus, of course, specifically, the government has reported on numbers which also Katja, of course, can confirm as regards applications for international protection. I think about 30,000. As regards regular migrants in Cyprus, we have noted in January 2020 about 90,000, which is close to 10% of the country population.
Wow, that's a lot. Mrs. Saha, I don't know if you want to add something. If not, I can ask you if you can tell us if there's a change in these flows of immigration flows because of the COVID-19, negative or positive change in numbers or flows, if you know.
Yes, absolutely. Look, what has impacted the number, the movements of individuals, be asylum seekers or migrants in the last months is, of course, the fact that many states have chosen to close their borders either completely or partially, leaving some possibility to asylum seekers still to access. So states, of course, have a responsibility to protect their public health, and they may temporarily close their borders to limit the COVID transmission, but provided that any such measure is non-discriminatory and it's necessary, it is proportionate and reasonable in all circumstances. So I think it is important to remind us that asylum seekers have the right to seek international protection at those borders and may not be returned in any circumstances, either directly or indirectly, to a country or persecution or danger. So the principle of non-refoulement is one of the really most widely recognized norms of customary international law, and it is clearly reflected also in the 1951 Refugee Convention and other instruments. So any kind of blanket measures precluding the admission of refugees or asylum seekers without measures to protect against refoulement will breach international law. And I think this has been kind of at the center of the discussion during the last months in Europe, where of course the fact that many countries closed the borders, it made it very challenging for asylum seekers and refugees to move, and this has, for example, in the case of Cyprus, it has of course resulted in reduced numbers, in reduced number of asylum seekers reaching the territory, because Cyprus is one of the countries that completely closed the borders with no exceptions to asylum seekers.
Do they go somewhere else, or do they simply not move from their point of origin?
Look, I think when we talk about Eastern Mediterranean, we cannot really ignore the fact that the situation in Syria continues to drive the largest refugee crisis in the entire world. And there remains over 5.5 million registered refugees from Syria in the main hosting countries, which are Turkey, Lebanon, Jordan, Iraq, and Egypt. So this means that geographically, of course, Cyprus is located very close to Syria. However, being an island, it is challenging to reach Cyprus, and the vast majority of Syrians who end up coming to Cyprus, they do so by transiting through Turkey, then by small boats accessing the northern part of Cyprus, and then crossing the Green Line. So this, what we consider, it's a secondary movement. It is very difficult at the moment to come to Cyprus directly from Syria. So the vast majority, of course, in this kind of a COVID situation, public health crisis with all the restrictive measures, have simply stayed in their first countries of asylum, regardless of the particular situation that might have warranted or not the onward movement. That of course in principle the asylum seekers should stay in the first country of asylum where they can find protection.
And when they leave from Turkey, I mean before COVID-19 at least, and they came to Cyprus, Cyprus is not a very attractive destination because it's not easy to move onwards. So why would they choose Cyprus?
Most of these, if we talk about Syrians now particularly, just to say that Syrians, however, do not constitute the majority of asylum seekers who come to Cyprus. They have been around 20-25% of the total number of asylum seekers that have lodged a claim in Cyprus. But regarding Syrians, most come because they have family members in Cyprus. So it is one of the issues that we have advised the government to address, is to regulate family reunification. There are, within international protection, there are different mechanisms to protect individuals. The clearest is, of course, the refugee status that we mostly know, and that's the notion that we use, that's the term that we use. However, for example, in Cyprus, only 4% of Syrians are given a refugee status, and the vast majority is given what we call a subsidiary protection status. And unfortunately, Cyprus is one of the countries in Europe, Malta is another, that has not only limited but completely restricted the access to family reunification for anyone who's under the subsidiary protection. So the only way for family members of Syrians to come to Cyprus is to come through using smuggling networks, arriving by small boats. Of course, we also occasionally have small boats coming from Lebanon, but the vast majority, however, because of the geographical distance, come through Turkey. So this is the reality. But I think it's also important to note that if we only look at the number of asylum seekers, it might be misleading. Because it doesn't match with the number of arrivals. So it doesn't mean that if, for example, in any given year, for example, last year, if some 13,000 individuals seek asylum in Cyprus, it doesn't mean that they arrived to Cyprus in that year. almost half of the asylum applications in Cyprus come from individuals who before had a migratory status. So either they have been working in Cyprus, very often as domestic workers, or they might have been students in Cyprus, and for lack of migratory alternatives, they then choose to put forward an asylum application so that they can legally prolong their stay. So this distorts somewhat the numbers that we see.
Thank you.
Dr. Adamides, if I can add on this topic, because obviously I agree absolutely with Katja. The situation in Italy, the catastrophic situation, has created migratory pressure for all countries in the sub-region, and of course Cyprus as well. But you ask, what has changed with the COVID, and maybe it's important to highlight here that most importantly, it has been a health crisis, but it has also been a socio-economic crisis and a protection crisis, which means that it has brought to the fore vulnerabilities, it has brought to the fore inequalities, and yes, it had an impact on mobility. Of course, governments have restricted on the travel, on borders, and yes, it has led to migrants being stranded, whether they are migrant workers or international students. But states have the right to control their borders. So what IOM is doing, the International Organization for Migration, is to support states on their immediate response to including the COVID, but as well as the socioeconomic recovery. And here, and thank you for giving us the forum, I wanted to highlight what we are doing as UN, what we are doing as IOM, because from the first moment we have adjusted our modus operandi. We have switched to virtual counseling for our beneficiaries who are working on voluntary return. We have battled misinformation, which is very important, by communicating wash and distancing measures in 27 languages, including Tamil and Sinhala. And we ensured protection of vulnerable migrants. In particular, we started in this period a collaboration with the social welfare services on unaccompanied minor children, which were transferred already through and amid the COVID from first reception to semi-independent living. We provided food packages and accommodation to beneficiaries in need, again with collaboration with the Ministry of Interior. And it is important to bring this in the spotlight because, and it should be made known that this period has brought to the fore this type of needs. And now that we are resuming back to border opening and travel, it is important again to health-proof our global mobility systems. These may include, healthy protocols at airports, but does also include migrants and refugees being in a position to report at points of entry and first reception centers if they are sick, without fear of arrest and deportation. So, and again, thank you for letting us bring that to the fore, the fact that migrants were part of the COVID as care workers, for example, in the emergency room in Cyprus. We know of cases with our collaboration with the Ministry of Health of migratory background that are doctors that helped during the COVID, as well as persons who worked in the agricultural sector, food processing and food delivery, that you may have noticed the migrants again were in the spotlight. So in the next phase, we are planning to work on combating those barriers that are preventing those migrants from contributing to society, to bring back and to contribute, as I said, in the socioeconomic recovery. So yes, things have changed during the COVID. The dynamics, migratory dynamics have been affected inevitably because of the government measures. But we stand ready to support government as well as migrants so that they are not penalized or punished in this period, because they have been contributing, and they should be, and they will continue to be contributing.
Thank you. If you know, is this these issues that you just raised, are these Cyprus specific, or are they also applicable to the rest of the Eastern Mediterranean countries, or maybe not just East Mediterranean, but further towards Greece or Malta or South Italy, or is this something that is unique to the Cyprus case?
The health crisis is a global crisis, as everyone knows. So it has more or less led to the same government measures across the globe, which has impacted the human mobility across the globe. So they are not Cyprus specific. We are, of course, looking at examples in the region to study further, such as those who have given extension of migratory visas to persons who may have fallen in the irregular cracks, for example, such as those which I mentioned before, who worked in the care sector or in the agricultural sector. We have seen such examples from Portugal or Italy, for example.
Thank you. Well, this raises another question. If it's not just Cyprus specific and kind of all countries have to face the same things, do you believe that the EU should be doing more towards, or the UN perhaps? So this is a question that Mrs. Saha can respond to, or both of you, that the EU or the UN could do something more to help the situation? Because it seems that you know, the East Med and these countries have, you know, take on a lot, and they already have other issues, economic issues, I mean. So what do you think? What is your view on this?
Well, the UN and the EU, of course, have been very closely monitoring the situation in all of the countries, and have engaged with all the governments, and this has led us as the UNHCR to realize that on many occasions the asylum seekers and the refugees indeed were not fully incorporated or included in the in the support measures provided by the governments. There's been very positive examples as well. But for example, if we talk about the situation in Cyprus, it really raised some concerns that both the EU and UNHCR has been addressing. So it is maybe not so much a question of immediate funding, but more on how to mitigate the measures that might be necessary for public health could also comply with the refugee protection requirements. So for this reason, what UNHCR did in particular, we issued in the end of March 5 recommendations. They were really key messages to the governments that we wanted to advocate for, and we wanted to also distribute for others to advocate for. First being what I mentioned in the beginning, that states can and they should, of course, ensure access to asylum also while protecting the public health. So these are not incompatible goals, and we have been advising the governments, insisting in all European countries and in the Eastern Mediterranean, and of course my office particularly in Cyprus, advising the government on measures such as screenings at the border, health checks. We have encouraged the quarantine periods for those who would arrive, but with the aim of leaving the door open for those who really are in need of international protection, who are fleeing persecution and who should be accepted also during this public health crisis. The second message that we really wanted to pass to the governments was that even when the state has closed its borders, like in the case of Cyprus, the reception of asylum seekers, the reception conditions of asylum seekers, and the processing of asylum claims should still continue, and the priority should be given to those who are the most vulnerable. And here we see that In practice, for example, in Cyprus, the immigration police stopped receiving asylum applications when the measures were implemented, and this meant in the practice that asylum seekers who were not registered also could not access any reception conditions. They could not be admitted, for example, to the camp, to the Purnara camp. They didn't have any meaningful access to health services. So also to know that sometimes the measures that are imposed by governments really are not in line with the public health requirements neither, because it's in the interest of everyone that all persons on the territory have access to healthcare services, that all arrivals would be quarantined and so forth. So the registration of asylum seekers still has not started in the practice. It was supposed to resume 21st of May, but there's been significant delays. The third issue that we wanted to stress, and that we have been working with governments across Europe, is to the restrictions of freedom of movement should really not be arbitrary nor discriminatory. So the quarantine measures, they may be legitimate restriction on freedom of movement, provided that they meet the international human rights standards. But health concerns do not justify the systematic or arbitrary use of immigration detention. Now in Cyprus, asylum seekers have been kept with in complete restriction of movement in the Purnara camp since the COVID measures were implemented, and the closed nature of the camp was then further prolonged with the decree from the Ministry of Health due to an outbreak of scabies. So we have been concerned about the unaccompanied children who are also being held in the camp among the adults. And none of these residents have been served an order that would justify the complete restriction of their movement. So these are situations that have happened, and that have also required us to take measures and to address them with the competent authorities. And also the fourth key message that UNHCR then published was that restrictions on the exercise of rights should be maintained for no longer than necessary. So there is, of course, a real risk that any temporary measure to respond to the virus might be maintained long after they really are needed, and this would diminish, of course, the respect for international refugee and human rights norms. And lastly, like Natasa also mentioned in the beginning, it's the public health and other responses should always include refugees and, of course, the internally displaced and other marginalized groups, and really address the particular risks that might be affecting them. So any situation that would hinder or put additional limitations to the access of healthcare, effective healthcare, of course, would not be also in line with the objective of public health. So these are really the areas where where UNHCR has been working during the last months, and we've been trying to address. And of course, there's Cyprus in particular receives important funding from the European Union that has helped to some extent address the needs. We have also provided material assistance to 250 tents and thousands of blankets and hygiene items to asylum seekers when the government had difficulties in procuring quickly the sufficient amount of these kind of items. So it's a combination of advocacy and material assistance that we have been providing.
Thank you. Koudouna, would you like to add something, or?
Yeah, sure. I absolutely agree that responses should be proportionate and legal and upholding humanitarian principles. And indeed, governments should do appear to be in a better situation to mobilize capacities with the support of agencies, including the IOM. We have in this period also developed standard operating procedures for infection and control, and we also stand ready to support as regards health measures, as I mentioned, in points of entry and across the country. You mentioned the resources. Of course, the Cyprus government does mobilize resources from the European Union, which are under discussion, of course, including the monies for the next period. In IOM, the EU is the second funding donor. But of course, challenges ahead with the UK leaving the EU do have implications with additional 3.6 million of EU workers there and 1.3 million workers in other countries. So there are several issues to be taken into consideration in the region. And last, I cannot reiterate enough the need to combat misinformation, because misinformation spreads fear, and we think that it is critical to maintain solidarity and cohesion at this time, so that the migrants themselves are not penalized, because the COVID does not discriminate. It affects us all the same way at the end of the day.
Well, you bring me to another question about the misinformation, and I think it partly answers what I'm about to ask, but maybe there's more to it. And it's in relation to this introvert behavior of states. Closing the borders is one of them, but also it's not just about resources and borders, but we also see that the states are kind of looking inwards for a solution to their problems related primarily to COVID-19, rather than looking towards international organizations. But this introvert behavior also led to more nationalism and a lot of populism and a lot of anti-immigration rise and feelings, if you wish. And I was wondering if you agree that this is indeed the case, if you feel that COVID-19 has led to this introvert behavior in a way that actually harms the perceptions towards immigrants, and if yes, what can we do about it? I mean, partly it's probably the misinformation situation that you just mentioned. Is there something else to it?
Well, I think, as I mentioned, it has at least temporarily altered the migratory dynamics the COVID has. Of course, there's been restriction in travel, but as I mentioned, the statistics show lower trends in the regular arrivals, and governments do appear better prepared, and they have scaled up capacities to approach the situation. So in keeping in mind the rights-based approach and following the humanitarian principles, it is a situation that can be managed following international standards.
Saha, would you like to add anything on this?
Yes, look, I would dare to say xenophobic attitudes that we have been noticing lately are more prevalent in Cyprus, and certainly I assume also in other countries during these times. We have noticed already that the attitudes of Cypriots and of course others who live in Cyprus started changing, not as recently as the COVID epidemic, but before. So I think it is directly linked to the fact that there has been a steady flow of asylum seekers to Cyprus in the last 2 years. Cyprus was not prepared or was not expecting that this would be a long-lasting situation. There was more of a feeling that since the Syrian war, for example, had been going on for so many years and still so few Syrians found their way to Cyprus, comparing to the other countries in the region, there was this kind of a feeling that nothing will change, but it did, and we started receiving more asylum seekers from Syria. There were new routes that opened from Western Africa, in particular from Nigeria, from Cameroon. We started noticing a year ago the significant increase in the number of West Africans who came, and then lately, during the last year, we also started noticing another trend that they're from Asian countries, especially from Bangladesh, from Pakistan. So these, combined with the number of those already in Cyprus who then chose to seek asylum to prolong their legal stay here, it really created this kind of a very alarmist attitude that people did not feel prepared and somehow were taken by surprise. But Cyprus is really at the crossroads of 3 continents, so somehow to us it seems also logical and unavoidable that as the mobility across the globe increases, it will also impact Cyprus. It did, and we see that the situation is here to stay. It is not a temporary situation, and Cyprus will simply have to adapt to this kind of a new reality. Now the COVID crisis, of course, added to that stress on how to handle these increasing numbers and the also increasing backlog in processing, because what we need to say is that there are some 20,000 individuals who still are asylum seekers because their claims have not been processed. So the system was not meant to handle this kind of high number, so the backlog kept growing. An individual who's an asylum seeker has very limited access to the labor market, and thus largely depends on the social assistance that asylum seekers are entitled to. That is not sufficient. An individual receives close to 100 euros, for example, a rental subsidy per month. Food provisions are through vouchers. And in any way, the social services were not able to cope with the number of demands. So this led to increased homelessness, this led to increased destitution, and of course the local population also started noticing this. There were asylum seekers sleeping in the parks, in the streets. The center of Nicosia suddenly seemed to host very large numbers of asylum seekers and some refugees as well. So all this kind of came together and has created more negative attitudes that unfortunately have been fueled by this misinformation in the media. So facts have been presented in a way that have not really given a full or correct picture of the situation. And often asylum seekers and refugees are presented in the same within the same number. They should absolutely be differentiated. Refugees who have been in Cyprus for long periods of time, for years and years, they have been integrated here. They speak the language, they work, they pay taxes. They should not be portrayed as a burden to the Cypriot society in absolutely any way. So the situation has unfortunately been presented by the media in a way to the public that has fueled racist attitudes. And we have noticed this in the practice also. We receive more and more reports about racist, also some physical attacks that did not happen before, but much more discriminatory attitudes towards asylum seekers and refugees in Cyprus. So it's a combination of factors, I would say.
Well, the situation in East Med is becoming more volatile, not so much in our region, but a little bit to the west with Libya and Greece and that area. So if things continue to go south there, things will escalate even further. So do you think, given what you have just mentioned, that there's a way for things to improve in the Southern European borders and in the Eastern Mediterranean, if the numbers increase, the economy suffered. Well, there was weak economies to begin with, the Southern Europeans, and now with COVID, it's even weaker. So what you have mentioned will probably get worse. How do you see a change, a positive change, if we have increasing numbers and an even more hurting economy? What should, on one hand, the government do? And I don't mean the legal stuff. I mean, what can they do without a lot of resources? And what should the EU do, for instance, to help, or the UN, to help the situation so as not to escalate, and so that we don't see more xenophobia and more racism and all of this that you have just very clearly outlined?
Well, there are definitely challenges, and then we see more challenges in the future. But when you have challenges, you also have opportunities. So it is really the perfect opportunity to propose new ways of dealing with asylum seekers. First of all solutions need to be holistic. So it is not possible to look at the asylum system separate from the migration management. They need to be looked together, especially in countries like Cyprus, where, like I mentioned, half of the asylum seekers, in fact, would be in need of a migratory solution instead of international protection. So what we very strongly have been suggesting to the government, and the government is taking steps towards implementing accelerated procedures. So the key is really to have a system that serves the purpose of those who need international protection and does not cater the needs of other groups or categories. So by efficiently processing claims, it will also pass a message to those who might not have international protection needs. If putting forward an asylum application more or less automatically gives some 3 to 5 years of legal residency in Cyprus, that is encouraging the abuse or misuse of the asylum system. So what should be done is very promptly and efficiently dealing with different types of claims in different manners, with different kinds of timelines. And this is what the government is now proposing to do, and what we have been assisting and guiding the government to do for the past years. So individuals who clearly do not have any international protection needs, who often already state when they seek asylum that they would just like to prolong their stay in Cyprus without having any kind of a fear of a persecution in their country of origin. These could be considered manifestly unfound claims. They do not need to go through a very lengthy, years-long detailed process. They can be very quickly decided, given a negative decision. Appeal process, there needs to be always sufficient protection safeguards. But once these are in place, there is absolutely no need to keep these individuals in the system for years. If in a very reduced period of time, they can be taken out of the system. There should be, of course, then a migratory solution for them. If there is none, the solution would be a return to the country of origin, or return to the country where the person came from, if that's legally possible. So this is something that the government is also taking steps towards. There was the very first return that concerned Georgian nationals. That was the first group of first nationality to be tested this accelerated procedures with. So this is something that we think that would very quickly also send a message to these individuals to say it is not worth seeking asylum, because very briefly you will be again in the same situation without legal residency in Cyprus. And this would of course reduce significantly the numbers of asylum seekers, and that would also free resources of the government to really provide adequate reception conditions for those who are genuine asylum seekers and who are in need of international protection. Because at the moment the system is spread so thin that nobody receives sufficient reception conditions, it is not possible to survive in Cyprus with the amounts that are currently given. So more focused attention could be given to real asylum seekers. This would, in UNHCR's opinion, be the most efficient solution to manage the current numbers. And of course, when there is an efficient system in the country, the information spreads very quickly. So it will be known, Cyprus would not be possibly targeted by smuggling routes, by smugglers who would then see that it is not feasible to use Cyprus or the lengthy processing in Cyprus for purposes that are not in relation to international protection needs.
Thank you very much. Before we move to the audience questions, because I just received some questions, Mrs. Koudouna, let me ask you the final question on my side, and it's about bilateral relations. We see Cyprus having many regional bilateral agreements, not necessarily on immigration, but on several other issues. And I was wondering whether they have played a role in handling the immigration situation in the region, in the Eastern Mediterranean.
Yes, thank you for the question. I think I already referred to it in brief, the importance of multilateralism, the importance of the UN migration network, where different agencies, including IOM and UNHCR, are participating, which are advocating for migrants to be included in the response and the socioeconomic recovery, the importance of the implementation of the global compacts of migrants and refugees, but also in particular the examples that I evoked before on not only in highlighting the need for addressing those vulnerabilities in this period, but as well as tapping into examples from the region whereby either those who contributed within the care and agriculture sector were extended their stay in order to contribute. Because I think it's important to note that in this period, including employers have reached out to us in the agricultural sector who have said to us, look, because of the travel restrictions, because of the closing of borders, we need labor, we need help, we need migrant workers who would have otherwise come to pick up their crops from abroad, seasonal workers, and in this period we need them. I think it is important to highlight that these, let's say, relations with countries in the region and support from migrant workers in the region will continue to exist and will continue to help the society in its economic and socioeconomic recovery.
Thank you. Let's move to the audience questions, and I say a couple. One is relevant to the specific case of Cyprus in the sense that it's obviously, we have the division of the island, and of course we have the internal checkpoints, and the question is whether how this complicates the work of NGOs and other actors. And if I may add to that, there's also a lot of discussion about Turkey using immigrants as a weapon, basically. So and as a form of hybrid warfare, in a sense, by kind of pushing immigrants and asylum seekers in the Republic of Cyprus. So how does the internal division influence your work, and what can be done? Well, obviously not for the solution of the problem, this is not your responsibility, but to handle things that you deal with given the situation in Cyprus. I think this is relevant for both of you, both as an NGO and UN. So please. Yes.
For UNHCR, of course, we do work in the northern part of Cyprus through an implementing partner. So we have a local NGO partner there who performs a function that is focused on the prevention of refoulement, that is really at the core of UNHCR's mandate. The challenges in the northern part of Cyprus, of course, are that as the area is not under the effective control of the government, there is no asylum system. There is nothing that there is no asylum-related legislation. It is not possible to seek asylum in the northern part of Cyprus. So the policy, the practice in the north, it is really that all the individuals who arrive and who are detected by the administration there, and who might be considered asylum seekers, who either say that they want to seek asylum or they are profiled as asylum seekers, they are detained and they are deported back to Turkey, because the most of them, of course, all come through Turkey. So for us, our role really in the northern part of Cyprus, it's to prevent cases of deportation that would amount to refoulement. What does this mean? It means that when a person is detained and not his right or her right to seek asylum is not acknowledged for the lack of a legal framework and asylum system, and in cases where we can determine through our partner that the person has international protection needs and thus is of concern to UNHCR, we would then advise our partner NGO to take action that would prevent this deportation to a country where this person could be further deported to a country where his or her life or freedom would be at risk. So in practical terms, this of course means that the vast majority of individuals who are deported, they are deported to Turkey, and we can then assess their situation in Turkey through our UNHCR office there and confirm that they have found a protection in Turkey and they have not been refoulement, they have not been further moved from the territory. So the concern is always individual. We never advise our NGO to partner to take measures based on nationality or based on any other general, let's say, characteristic of the individual, but it's always based on the individual protection risks that must be assessed. However, the challenge is that the vast majority of individuals who transit through the northern part of Cyprus, they never come into contact with our partner NGO. They do not come into contact with the administration, with the de facto administration in the north, because if they did, they would be detained and deported. So they simply find their ways to cross the green line, and we only come in contact with them once they contact immigration police in the Republic of Cyprus and are then transferred to the first reception center. So in practical terms, we have very little opportunities to influence the decisions of these individuals, because we only come across them when they already are on this side of the green line. Very few decide to stay in the northern part of Cyprus. There are less than 100 individuals who have chosen to stay there, and our partner NGO is in contact with them, and they are allowed to stay in the territory, and they are confirmed to have international protection needs, and thus they can we provide social counseling and some very basic services for this reduced number of individuals.
Thank you. Mrs. Koudouna?
Well, I think the question was in general on how the migratory flows are impacted, and I think the situation in Syria, we referred to it before, has impacted all its neighborhoodly countries, including Greece and Turkey, and all the more it has penalized the migrants themselves. We also referred earlier that the catastrophic results of the Syrian conflict, I think this is widely known. So IOM2 is calling on all partners in the Syrian conflict to find a solution, which is, of course, the effects of which that we are living right now. That's all I have to say.
Yeah, that's a big challenge given the circumstances. And well, we reached our time limit, and I would really like to thank you and well, wish you best of luck with the very important work that you do. It's really important because I think this was the very first thing you noted. We're talking about humans. We're talking about people, not just policies and money and resources. And this is absolutely essential to remember. On the negative side, things are not looking very peachy in the neighborhood, and hopefully we'll find ways through multilateral approaches to become more efficient in handling the situation and help the people. So I would like to thank you once again for your contribution and for being here with us. It is truly appreciated. And before we close, let me tell the audience about the next video podcast of EMSI, the fourth one. It's on the impact of COVID-19 crisis on the global oil and gas industry. And we'll have with us Dr. Simeon Kasyanidis and Dr. Bagat Gaudad from the National Security Affairs. And this fourth podcast will take place on June 29 at 6 p.m. So with this, once again, thank you very much for being with us, and hopefully we'll talk again soon, close next time instead of via Zoom. So
thank you very much for having us. Thank you.
Thank you.
All right.